Thank you for staying with us on Channels Television. A warm welcome to Health Matters. I am Yomi Otaibi. Today on the program, our discussion will center around cholera prevention and control. Between January and May 2022, a total of 2,339 suspected cases, including 74 deaths, have been reported from 30 states. Of the suspected cases since the beginning of the year, age group less than 5 years is the most affected for male and female. Of all suspected cases, 50% are males and 50% are females. 5 states account for 68% of all cumulative cases. They are Taraba, 651 cases, Cross River, 593 cases, Katsina, 134 cases, Kano, 124 cases, and Benue, 100 cases. 6 LGAs across 2 states of Cross River and Taraba reported more than 100 cases each this year. How can cholera be nipped in the bud and controlled? For answers to these and other questions, I have with me in the studio a public health physician and Director General of Cross River State Primary Healthcare Development Agency, Dr. Janet Ekpayong. Thank you so much for being with us.
Thank you so much for having me.
Let me take it from the 6 local governments, that accounted for 68% of the cases, and Cross River State is well represented, if I can use that. So tell us, what is accounting for this in your state?
All right, thank you very much. We know that cholera is actually one of those very deadly diseases. And why Cross River State is actually implicated is because, it's a riverine state. There are a lot of communities that are, riverine communities, and so most of those places are islands where their main source of water is actually from the river, and that's why most of those cases were actually reported or suspected cases, however, because further investigations really revealed that most of the suspected cases were not really cholera. However, because of diarrhea, it actually called for further investigation and the rest of it. But I'm glad that at least we didn't really record a lot of mortality that which was our major fear, But I'm very happy that most of them are all doing very well currently.
Okay, so we all know cholera has to do with water and sometimes, the exposure of the food that we eat. Is it that the people don't have the information as to how to treat their water, even if it's to boil? Is it lack of information on the part of the people, or, the government giving this information out?
So we've done a lot of sensitization. As part of our social mobilization strategy or information dissemination, we ensure to always give that very integrated health messages across. And of course, issues around cholera or diarrhea diseases are integrated in such messages. And so I wouldn't say it's lack of information. I think at the end of the day, that boils down to the attitude of the people, because even if you keep giving all the necessary information, when it's actually time to actually implement all that you've learned, that's where the problem really comes up. Because we know, in as much as we know most of them get their water from the stream, we expect that at least before you drink the water, you should have boiled the water. And even using them to cook, or using to wash some of the cooking utensils in the house. And we know that because of this, it has actually led to, people recording cases of cholera. And we know that government is also trying a lot to see how we can also change the narrative where people don't have to depend on only streams as source of water by, ensuring to those communities have boreholes where that could also serve as an alternative source of water. But because of, like I said, it's a riverine communities mostly implicated, and especially now that we're already going into the rainy season.
We are full fully into it.
We're fully, exactly, into the rainy season. Open defecation is always a very huge problem, for communities where don't really have some of those wash facilities, sanitation facilities, to help them. So it's also very common in all those places. And just like a practical example where a mother whose child just defecates in the open and maybe rain falls, that could just easily wash that, straight to the streams
Sources
and all that.
water.
And of course, people just go in fetching without necessarily having to boil. So the information is there. We continuously engage with them. But when they go back home, to actually practicalize what they have learned is always a major problem.
What is government doing in terms of helping them get, portable water too? Because if they have it coming right from the tap, it could reduce the chances of having, contamination.
Absolutely. Part of what His Excellency Senator Professor Ben Ayade has been doing in our various communities, seeing how at least from every LGA communities, of course through the local government chairman and some other organization, even through RUATSA and the rest of them, seeing how we can get communities, give them, sink boreholes in those communities, to also serve the people. Because we believe that water is key. I mean, that's like the major source of where cholera or many other diarrhea diseases come from. So that's alone, that he's already doing that in a lot of communities. However, for people that, it might also interest you to know that even communities where they already have boreholes, people still go back to want to get water from streams, because of their beliefs or whatever notions they have that streams are, the water from streams are very natural, or probably they taste better. These are some of the issues that we still face, even in communities where they have boreholes. So that's where we're not also relenting in our engagement with community leaders, ensuring that they actually insist on people, going to use or get water from those boreholes, rather than still going to the streams, to get water that could be contaminated. And also seeing how we can encourage them to please continuously boil their water, even when you get it from the boreholes. It is still expected that one way or the other, you should still, boil the water, because you just never know. Probably the utensils or whatever you're using to fetch that water could also be contaminated. So government is doing a lot in that regard.
Let's look at, nationally now. We know that Nigeria is an endemic country when it comes to cholera. We periodically, seasonally, would have, particularly, this rainy season, would have cholera. And this year, just between week 1 and 22, we have over 2,000 suspected cases and 74 people, dying. And that is no, small figure when it comes to, losing lives. How can we better manage this on the part of the people and on the part of the government?
All right. So we know that one of the major cause of mortality in people that have of diseases like cholera is usually dehydration as a result of diarrhea. And so we always encourage, even at the community level, for instance, mothers, what we always say, before then we used to say, you just teach people how to mix the oral rehydration solution. But now at least we have that in sachets right now. And we encourage mothers at all times. You should always have that in your various homes, even on your carry-on bags, because that's always the major cause of death or mortality. Dehydration as a result of diarrhea. So once we're able to at least institute, care, or institute some of these palliative measures, to help, continue to rehydrate the child, then you're sure that at least you can have that child still alive until you're able to really investigate and know what might be causing the diarrhea. So that's is initial care that you give to that child is very important. So at all times, you must always have that ORS and zinc with you. Of course, at the community level, we try our best best to ensure that at least they have access to quality water, which is very key. And of course, make sure that other wash facilities of, like I said, water sanitation, and of course the environment. So hygiene is very, very important. And that's why we always, advocate to community leaders, people in the communities, women, youths, that where you live should also be a reflection of your own kind of person, making sure that everywhere you avoid having very dirty environments. Your source of water should be, of course, very clean.
Making sure that food is also well covered.
Yeah, and even if you don't have access to maybe what we might consider to be modern sanitation facilities, even the pits that you dig, in your various communities, the ashes that you produce from cooking, that could also serve as a disinfectant. When you're done, you could use it to spread around your pit latrine and the rest of it, and ensure washing your hands, after using the toilet.
So hand washing is very key.
It's very, very important.
There has to be water, clean water also, for you to be able to wash your hands with, of course, soap too. Let's talk about vaccine. Is there vaccination for cholera?
So yes, there's vaccination. We have the oral cholera vaccine. However, in Nigeria right now, that has not been included in our routine immunization. But whenever we have outbreaks, the federal government, of course, in collaboration with so many international bodies, usually bring that in, to tackle that area where the outbreak might have occurred. But right now, we've not introduced that formally in our routine immunization in the country. But we're hoping that eventually that will come. I'm glad that at least it's always part of the response whenever federal government is intervening in areas that have such disease outbreak. But we're not relenting. We'll continue to advocate for more integration of such vaccines in our national immunization programs, because I believe it's better we always act proactively. Right now, we have the rotavirus vaccine, which by next month will also be included in our national routine immunization. Because we know that diarrhea, most of the major virus that is usually implicated is the rotavirus, and that will be included very soon. So I'm hoping that as time goes on, even the OCV and the rest of them will also be integrated into the routine immunization programs.
Okay. The symptoms we know, stooling and vomiting and all. Is there any other thing that could point to cholera even before all of those vomiting or stooling?
Okay, so I think that's just the major thing that gives it away. That could be, suspected case of cholera. Of course, sometimes it's asymptomatic, no doubt about that. But what really brings about the concern issues is once there's diarrhea, and we're worried about diarrhea because, the child could eventually become dehydrated, and dehydration is what we are really, really concerned about. And so once there's diarrhea, of course, there could be pain, stomach pain, there could be fever, and the rest of it. But the first thing we do in terms of the first treatment is we conduct what we call the RDT, rapid diagnostic test, immediately. Of course, we would have initiated the oral rehydration solution. At least once that test is done, it could also point that, this could actually be cholera. However, a confirmatory test needs to be done, which is the PCR, the polymerase chain reaction test, where, of course, sample of the feces of the infected, suspected case is taken for further investigation, and that is confirmed. But before all that, definitely treatment would have been initiated to make sure that at least you can resuscitate the child. Because, like I said, what we're really concerned about is that dehydration, because that's usually what we are worried about, so it doesn't lead to a child going into shock or even death.
Cholera can be very,
absolutely highly dangerous.
Dangerous, and if it's not taken care of quickly. We'll go on this break, and when we come back, we'll talk more about how to ensure that, it is not rapidly spread also when we have, some cases of cholera, so that it doesn't become an outbreak. We'll be back in a moment. Please stay with us. Thank you for staying with us. I still have with me in the studio the Director General of the Cross River State Primary Healthcare Development Agency, who's also a public health physician, Dr. Janet Ekpayong. Doctor, thank you for staying with us.
Thank you.
Before we went on that break, we were talking about, how to manage, this and some of the signs and things that we can know. I said cholera is highly contagious, and which you mentioned. Is this something that should be treated at home?
Okay, so if it's just a very mild, symptoms like, like I said earlier, we're just concerned about the dehydration that could result as a result of diarrhea. So if it's mild, just mild diarrhea and all that, or mild dehydration, then of course we can just manage it at home based on how the child presents. But we're always very concerned, like I said, because it could just rapidly lead to something, especially if the loose stool that the child is, of course, losing is really continuous. Then you just have to quickly take to the health facility. But at home, what you can do is to, first of all, initiate the oral rehydration solution and, of course, the zinc tablets, which we encourage every parent should have at home, before the child is taken to the health facility. Now, at the facility level, of course, we'll ensure to do the rapid diagnostic test. And, of course, if it's suspected cholera, then initial management will also be instituted. Before then, so of course, samples would have been taken, so they could be taken to the lab, where a confirmatory test will be done, of course, during the PCR, to actually confirm if it's cholera. But the good thing is that management would have been instituted while, of course, further investigation.
Waiting for the outcome of the result.
To make sure that, but you must make sure that the child is stable. But that's the most important thing for us. Yeah.
Okay, because it's also highly contagious. I know in the hospital or health facilities, there should be infection prevention control, but for the people taking that person that is suspected to have cholera to the hospital, what should they do? And then what should the healthcare worker also have in mind?
Okay, so the good thing is that we have highly trained health personnel whose responsibility is in taking samples and the rest. Of course, the disease surveillance and notification officers. They've also been trained, as well as other health workers, maybe lab technicians and the rest of them, who have also been trained on this. Of course, they've also been put through on how to handle samples and all the infection prevention and control measures they're supposed to follow through. Even at the facility level, the health workers who are managing such patients, of course, have also been trained on what to do, all the infection prevention and control measures, and of course, wearing their gloves, making sure that everything they're doing there is well sterilized, all the way, even when samples have to be taken and all that. So at the facility level, all those measures are really put in place, because let's not forget, you have other patients there that you have to also cater to. So when you're finishing with one that is already maybe has cholera, of course, you have to also make sure you wash your hands, sterilize your hands before you proceed to the next patient. But definitely all those measures are being followed. And of course, when such cases are being suspected of being, like I mentioned, the disease surveillance and notification officers are also notified. And of course, they also come in and carry out other further testing and sample collection, which are further taken to labs where for confirmatory tests and all that.
Surveillance is very, very key, because sometimes it prevents reactions and, put in place measures to prevent the outbreak itself. So how strong should, disease surveillance be?
No, it's surveillance is more of a very proactive measure, making sure that you can actually curtail disease outbreaks even before they occur. And that's why once a case is mentioned, a particular case is mentioned, you already see a lot of people going in to make sure that they can nip it at the bud before any other spread. So surveillance is really important. And I'm also glad that we have surveillance officers across our various LGAs. And we also have community informants, people that have also been trained, because we also believe in tax shifting. I mean, the surveillance officers cannot be in all the communities. So we also have people that have been trained in those various communities. And also working with organizations like WHO, they have field officers as well that are working with state government and of course, all our health team to intensify surveillance across board, especially in areas that we know are really prone to some of these diseases. However, their surveillance is not just for cholera. There are several other diseases, so it's an integrated process, making sure that all that is being checked, and for us to also act proactively rather than always reactive to diseases or any other outbreaks.
Now, let's quickly talk about the role of breastfeeding, because in some of the figures that we've seen, we see that this happened in children less than 5 years. And breastfeeding has been mentioned to be, one measure that helps the child, to have strong immunity. What's the role that, adequate breastfeeding can have in this situation?
Absolutely, breastfeeding plays a very huge role, and that's a very nutritious, a healthy way of also raising a child. Right from infancy up to when they would have been able to build their own immunity to tackle whatever diseases that might want to attack their system. So breastfeeding is very, very important, and that's why we encourage women or mothers to ensure to breastfeed your child exclusively, for 6 months, and of course continue to when they are 2 years. Because apart from just building immunity, of course, all the necessary nutrition, it's very healthy, it's highly nutritious, contains all the minerals, the vitamins, name it, and it's very key. That's why even when a child even comes out with diarrhea, we expect you not to stop. You have to continue, because eventually the diarrhea will go, and of course it's giving the right nutrition the child needs to further strengthen that immunity. So we totally encourage and continue to promote breastfeeding all through infancy till the child grows up, because it just plays a very huge role in eliminating or preventing all these diseases in the child.
As we wind down now, just remind our viewers what they need to know about, cholera and the action they need to take once they sense, there is a suspected case.
All right, so cholera is one of those very dangerous diseases that each and every one of us need to be very cautious. And we're really concerned about paying so much attention to cholera, because its major symptoms, which is diarrhea, could actually lead to a child going into shock or eventual death. And that's why we encourage caregivers or parents to ensure that at all times you need to be very conscious, ensure that your children have access to water, quality sanitation, as well as hygiene, both environmental and personal hygiene. As you prepare food for your children and your family, ensure to wash your hands thoroughly. It's key. It's very important, because not just does it prevent cholera, but it prevents several other diseases. So hand washing is key. Boil your water. That is very important. Wash your vegetables and other sorts of cook your meal properly.
And wash the fruits too.
And as well as the fruits.
Thank you so
to
much,
make sure that you can protect your families.
Thank you so much, Dr. Janet Ekmayong, a public health physician and the Director General of the Cross River State Primary Healthcare Development Agency.
Thank you so much for having me.
Thank you. And that's the show for today. Thank you so much for watching. I am Yomi Otaibe.